Let's come back here at home now, because the Centers for Disease Control are warning of an alarming increase in several dangerous superbugs that have been found now at U.S. hospitals. They're called CREs, and they are germs that become extremely resistant to any antibiotics. Very dangerous stuff we're talking about. 42 states have now reported that at least one patient is suffering from an infection from these CREs, and the whole thing is more common, we're told, in the northeast part of the country. They have increased from 1% to 4% over the last 10 years, and they kill up to half of the patients who get this superbug germ into their bloodstream. Dr. Manny Alvarez joins me, Senior Managing Editor at FoxNewsHealth.com and a member of the Fox News Medical A-Team. This is scary stuff, Dr. Manny.
Very scary. 1 in 25 hospitals basically is infected with these types of bacteria. These are carbapenem-resistant Enterobacters. In other words, bugs that we usually see for UTIs, for pneumonia, wound infections.
Upper tract infection?
Right, pneumonias, okay. Klebsiella, E. coli, bugs that everybody's very familiar. They have become resistant to the last antibiotics that we have available. And they get embedded in hospitals. They get transmitted from person to person. They make surgical challenges. I myself have been dealing with a patient now for a while with a resistant bug. And it's really creating havoc. Now, why is it happening? I think a lot has to do with overcrowding hospitals, number one, because right now the turnaround, occupancy in many hospitals is 100%. You don't have enough time to clean the beds and things of this sort. And also these bugs have evolved genetically. They have evolved perhaps because of the overutilization of antibiotics in the past. So this is a big challenge. Who
is most at risk, and what can we do to lower our chances of having this happen?
Well, look, everybody's at risk. You could be a healthy person and, go for an elective cesarean section. Like in my case, we put a catheter in and you get an infection. So now things that we're doing is removing catheters quickly. We're prepping we're using different kinds of chemicals to prep surgical wounds. We're trying to send people home as fast as we can. We're trying to do infection control by cleaning operating rooms and hospital beds more efficiently. And look, at the end of the day, this is being put out by the CDC, but you have to remember, we will get punished as hospitals and doctors if we don't bring the infection rates down. In other words, Medicare and Medicaid will say, you know what, Dr. Manny, we're not going to pay you because, 20% of your patients are getting these types of bugs. So we have to do a job of basically moving people out, do a better job of cleaning hospitals. And, I think things are going to get worse before they get better, because with the overcrowding hospitals that we have coming now, especially with the new health care reform, this is going to be a challenge. But nonetheless, this is something that we have to do because the morbidity and mortality of these bugs are very high.
There's those antibiotic things all over, the gel, all over hospitals. Do they help at all? Because it sounds to me like you're talking about things that are transmitted really in the operating room.
No, but, the healthcare professionals, we have to do a better job, washing hands before we touch any patient. That's a must, and real hospitals that have really brought down the infection rate do things like that. In other words, infection controlled, explaining to the staff, to anybody, it could be a nurse, it could be an assistant nurse, that you have to have, proper hygiene. This is a campaign that many hospitals have to do. Because
can you find out the rate of infection at the hospital that you're going to?
100%.
How do you find out?
This is reportable. All infection rates are reportable. Every state carries the list of, infection rates. These are things that are reported. And there are many.
Your state health department would be where you find out?
Absolutely. Yes, absolutely.
All right. Dr. Manny, always informative. Thank you very much.
You got it.
Good to see you.
Thank you.